Welcome to ADAPT NCLEX clinical judgment case study walkthrough. We're going to solve next generation NCLEX question. Simple question. I will give you the question, interactive manner. You put down your comment in the comment section and we work through it in a simple way as much as possible. Let's get to it. So this is the first case. You have a 14-month-old male. He was brought in by the parents. We have an emergency room setting. So that's the situation we have. What is the chief complaint? What are they complaining about? This 14-month-old is breathing really fast. He's not eating anything. He threw up like what? Twice. The way to answer next generation case study is to look at the case, start thinking about the situation. 14-month-old vomiting and throwing up and increased respiratory rate. Does that ring a bell? Something should be now going to your mind and saying, what is going on with this patient? And what do I need to do to figure out what is wrong with the patient? That's the first thing you ask yourself. This is the few history I'm giving you. The kid was found playing alone with grandmother, right? In his room. The parent did not know what happened, unsure what exactly happened. The kid is being vaccinated. So this has nothing to do with vaccination, right? So what do you think? There's no fever, absolutely no fever at all, right? No medication, right? No illness. The kid is not having anything associated with this problem. So this is so far. Can you figure out what is going on with this patient? The grandmother takes daily medication, but we don't know what kind of medication the grandmother takes, right? That's the issue you have to figure out and try to figure out based on the case. So what do you think is going on so far with this patient? That's all. That's what I want you to think about. The next thing is, this is the rest of the case. They obtained ABG, and this is what they found. This is what they found on the ABG. In the ABG, the pH is 7.48, right? And the PCO2 is 28. The bicarb is 18, right? Blood glucose is 60. Potassium is 3.2. Lactate is 2.7. The creatinine is 1.1 and the PT is 17. Look at it. When they give you this, you're doing next generation NCLEX question. Look at the situation and figure it out if this is something that you know is abnormal. Does this lab make you worry? Does they give you an issue that, hey, this is not great. This is not good for this patient, right? So this is the case I want you to think about right now and keep on thinking about it and then try to figure out what we need to do. Let me start from the back and see. The kid was found alone with grandmother, right? And grandmother left the kid alone. There's no fever. There's no cold symptoms. There's no medication that the kid was on. But what is the problem? The grandmother usually takes some medication. We have no clue. We have no clue what medication grandmother usually takes. So what do you think is going on with this kid? That's all. That's what I want you to think about. What do you think is going on with this kid right now? What is going on with the kid? What is going on with the kid right now? So think about it and we'll figure it out later on. So the case study, I give you the lab work. Take a look at the lab work in a few minutes and see what does it indicate. Look at the pH, look at the ABG, and then look at the BMP. Does this give you a pause? Who knows what is going on with this particular patient? Is everything normal with this patient? It's a next generation case study. We're just walking through each one by one to figure out what we need to do with this patient. Does anything make sense to you right now with this patient? See any abnormal things in it? In the BMP, do you see any abnormal stuff in it? And that is fine. If okay with the CO2, that is fine. If you're okay with this, that is fine. The same thing. This is the physical exams. This is the temperature. This is the heart rate, respiratory rate. This is how the kid is breathing. That's the blood pressure. That is the neuro exams. This is exactly what the NCLEX will give you. And this is what they will give you. Can you make sense out of any of them? See any abnormal lab or physical exam, put it in the comment, right? Bicarbonate of 18 is too low. CO2 of 28, I don't like it. Glucose of 60 is also too low. The creatinine is fine. Lactate is normal. How about the PT? What is the normal PT? If you know the normal PT, put it down in the comment. But what is the normal PT? The normal PT is like 11 to 13. So this is elevated, abnormal. Well, there's a toxic screen that is still pending. The kid vomit 3 times. Do you like it? His skin is still pale and clammy. He doesn't want to eat. Which of these you don't like? His temperature is 101.4. Who can calculate the ABG acid-base status? Which of this? What is the ABG? If I say, tell me what is ABG means, what would you put, right? What ABG results would you give this patient? His pH is 7.48. His CO2 is 28. His bicarb is 18. What, if you have to calculate, what would you put over there? What do you think? I can tell you 7.48 is not normal. CO2 28 is not normal. Bicarb of 18 is not normal. Acid, this is a base, so we have alkalotic. But what is causing the alkalosis? Well, I know if it's alkalosis, CO2 is low, it's low. But why would the bicarbonate be low? Something is not right. So what do you think is the acid-base status of this patient? Tell me what you think. Acid-base status, 7.48, 28, and 18. Is alone represent what? This is respiratory alkalosis because the CO2 is 28. But then we have bicarb of 18. When bicarb is too low, that is acidosis. And what causes acidosis? Metabolic. So we have what we call mixed respiratory problem and metabolic respiratory problem. So we have mixed acid-base status. We have respiratory alkalosis and metabolic acidosis. These tell you this is an issue. It's not just a respiratory problem. This is a respiratory acidosis. No, respiratory alkalosis. And this is a metabolic acidosis. Therefore, we have a problem. This is what we call mixed acid-base status. Something should tell you when that happens, it's not because the kid is dehydrated or something. It's because there is something in the kid's system that is affecting it. The kid has ingested something that is affecting the overall acid-base status. Therefore, what do you want to do? What do you want to do? And what should your diagnosis be? Is this a viral gastroenteritis? Is this a febrile seizure or possible toxic injection or pneumonia with dehydration? What is the most likely condition that has resulted in this situation? It cannot be viral injection. Viral injection will lead to diarrhea, right? But it's not going to lead to respiratory and alkalosis and metabolic acidosis at the same time, right? It's not febrile seizure. I did not tell you the kid is having a jerky movement. It's mostly toxic injection. He ingested some toxic chemical from the grandma. We don't know what it is, but the acid-base status should tell you that the kid injected something. This is not dehydration. So what action should the nurse take immediately or anticipate from the provider? What do you think we should be doing now? Yes, respiratory alkalosis, metabolic acidosis, the kid is lethargic, is vomiting, what actions will you do? So based on this physical exam, this thing, what are you going to do? I can tell you the first thing, we got to monitor the cardiac heart rate, be on the cardiac monitor to see what is going on with the patient. Obtain tox screen because we don't know what is going on with the patient. All the acid-base status changes, we need to do that. He will need some fluid. His glucose is low. He needs to be hydrated because he's not eating, right? And then we prepare to give them activated charcoal because something is not right. Grandma pill the kid has taken. And then we check his INR or PTT. There's a reason why. And then assess the mental status. What do you think the kid took? Let's go back again. What do you think the kid took, right? The story said they found playing alone in grandma's room this morning. The parents are unsure what he got into. He's not vaccinated, but no fever, no cold symptoms last night, no known medication or illness. Grandma takes daily medication. He kept it in his. What do you think the kid took? That can lead to respiratory alkalosis and then metabolic acidosis. Those are the things you have to figure out. This is a classic case study that shows up on the NCLEX. So what would you want to do? Trust me, this is a case study that shows up on the NCLEX. And it's a common thing, you know about it. When we finish the end, you see that you know what is the medication. It causes respiratory alkalosis, metabolic acidosis. And I told you what we need to do for the patient. We provided all the necessary stuff. The diagnosis is what? Toxic injection. Since you've not been able to figure out, I will tell you, the baby took in what? Aspirin, salicylate intoxication. So this is a salicylate intoxication from grandmother leading to respiratory alkalosis and metabolic acidosis and all the condition with the PT that is very high. If you know this is what? Salicylate injection, what medication now would the provider give? What do you think? How do you treat salicylate injection at this point? What is the antidote? That's what the question is asking you. What is the antidote to take care of this problem? The antidote, if you know the antidote, what is the purpose of that? So what is the antidote for salicylate injection and what is the purpose of using that medication? Why are we giving it to this patient? We're going to give them something to try to get rid of the medication through the kidney. That is number one. Some antidote doesn't bind to the medication itself. They help get rid of it. So if I take a bunch of salicylate, what would you use to help me get rid of these from my kidney? Right? We have to alkalize the kidney. So they will take sodium bicarbonate. Remember, of the metabolic acidosis, we need to give them sodium bicarbonate. This will make your kidney alkaline, the urine alkaline, and that will get rid of the salicylate component. So this is what the provider should provide to the patient. And now, since you know what is the problem is, let me show you something. 2 weeks later, the kid had a what? Low-grade fever. Think about it. We know it's salicylate. He has runny nose. He has low-grade temperature. The grandma, once again, give the kid half teaspoon of Pepto-Bismol every 6 hours for 2 days. Parents say, hey, now he's very sleepy. The kid is not walking well. He had one episode of vomiting and he's rolling his eyes. You see, grandma is causing problem. What is going on? 2 weeks later, the kid started having running fever, runny nose, low-grade fever, and grandma give the kid another Pepto-Bismol. What do you think? Now the kid is sleepy, he cannot walk, he had episode of vomiting and rolling up his eyes. Does that give you a clue? What do you think is going on with the patient? Tell me, you can put that down in the comment. So what is your diagnosis? If you know your diagnosis, what kind of intervention do you provide? That's all. I can tell you that we got to check AST, liver function, right? We got to check the ALT, which is our liver function. We got to check the PT again and INR. Does that ring a bell? What should be our diagnosis? What do you think should be our diagnosis? I got to check ammonia level. What should be my diagnosis? Does he come back yet? You should check the kid ICP. They are not going to do well. What? The kid that's been given Pepto-Bismol. So I'm doing all these lab work because of the Pepto-Bismol. What do you think happened? Why is the kid sick? What do you think? We need to get the ABG again to see what is going on. We're going to see metabolic acidosis. Same thing. What do you think? The kid may need a CT scan. Does that ring a bell? What do you think happened to the patient? Those are the things. And then the sugar, the kid's sugar will be low. Glucose is going to be low. This is your lab work. And this, we have to find the diagnosis. So let's go back and figure out what this diagnosis is. The kid, but grandma decided to give the kid what? Low-grade fever. He had a low-grade fever. He has runny nose. He has low-grade temperature, right? And then the grandmother gave the kid half teaspoon of Pepto-Bismol every 6 hours. And now he's sleepy. He's not walking. He has episode of vomiting and he's rolling up his eyes. Based on that, what do you think is your diagnosis? I have URI symptoms and I've been giving Pepto-Bismol. That's your diagnosis right there. So what is the diagnosis for that? What do you think? Very, very important to understand this case study is because the kid has Reye syndrome. This is what is going on with the kid. Reye syndrome. Because Pepto-Bismol has salicylate in it, right? And the kid has UR symptoms, you should not combine them together. And that is what has led to that. That's why we have to do all these things. AST, your liver function is going to be affected. ICP is going to go up and the glucose is going to decrease. And that's what is going to kill them. This is a case study that I encourage you, if you're going to take your test recently, you should watch it. Take care of yourself and have a good day.